Now we move towards another interesting aspect of alternative medicine, which is homeopathy. It was basically formulated in the 1796 AD by Samuel Hahnemann, and this was supposed to be a medicine built on empathy and experimentation. And here is Samuel. The origin story is really interesting because it was based on an experiment on the Sinhona bark. So this is the diagram that I could find, which looked appealing enough to put in the presentation. So what Hahnemann did, he took these leaves, which were in fact a source of quinine, which later on was used to derive medication for malaria. And when he took these leaves, he developed malaria-like symptoms. So his ideology was, at the time, he hypothesized that like cures like. And because of this, what happened was, he in fact ended up making a wrong assumption, because problem is that quinine can cause synonism, which is a syndrome with feverish feelings, headache, tetanus, oh my god, that's tinnitus, I'm sorry, nausea and malaise. These effects overlap with malaria symptoms, so though they are not identical. So imagine, you're like this old guy in the 18th century, and you take this medication which is supposed to cure you of a condition, and you start feeling like you have the condition when you take the medication. So that's where he got his ideas from. But one good thing was, he was one of the earliest to demand that doctors test drugs on themselves before using them on patients, which was a primitive precursor to the clinical pharmacology aspect of medicine that we have these days. So his core beliefs were that like cures like. One crazy thing was, he believed that extreme dilutations would cause the medication to become more potent. That is, potentization of the medication, and that the state of disease in a person was due to disturbance in the vital force. The reason that this became popular was, in the 18th to 19th century, most of the guys out there were doing crazy medicine, which included bloodletting, purgatives, toxic metals, and there was no idea of asepsis or no idea of anesthesia. How homeopathy comes into this was, it was gentle, it caused fewer harms, and it seemed beneficial. But scientific limitations to this was that the dilatations which were done were beyond Avogadro's limit. That is, no molecules remain. So there is no active molecules remaining, there is no measurable mechanism, and there was no reproducible clinical effect beyond placebo. What is placebo? Placebo is a fake treatment that can make someone better simply because they expect it to better. For example, we have these two little gentlemen over here, and Mr. Doctor is giving this thing to his patient. He's saying, this will make you feel better, and this thing could be, the medication that he's giving could be real or fake, and the patient takes it, and the patient is like, I feel better already, and this is because he believes that it will make him feel better. So in fact, since starting, all the medical practices that we've been talking about have more or less been part of alternative medicine. So for example, we touched bases on Ayurveda, naturopathy, homeopathy, and Unani. We have not touched on this osteopathic medicine, but we'll get to that, and all the stuff. So this is another image just talking about how, given a placebo, patient expects benefits, and because of this, there is a release of endorphins or dopamines, which cause pain relief. Let's talk about now that we have read and understood different types of alternative medicine. Can alternative medicine be dangerous? So alternative medicine is not clinically proven, but some choose it over conventional medical treatment. For example, cancer patients that choose alternative medicine in favor of conventional medicine are less likely to survive, as per this graph. So